In the communities of Zamfara and throughout northern Nigeria, pregnancy and childbirth have traditionally been a source of fear as well as joy. For complex cultural and historical reasons, women and children here have carried the tragic burden of avoidable death, disability and disease. In northern Nigeria, mothers and babies are more likely to die in childbirth even today than almost anywhere else in the world. But the situation is changing. Since 2008, the Partnership for Reviving Routine Immunisation in northern Nigeria, Maternal, Newborn and Child Health has been working with stakeholders to save lives.
The purpose of PRRINN-MNCH is actually to improve the quality of lives of women and children in Nigeria.
By incorporating antenatal, maternal, newborn and child health services, the PRRINN-MNCH cluster care approach is revolutionizing health outcomes. As a result, mortality is dropping among these vulnerable, high-risk populations, and lives are being saved. PRRINN-MNCH also used the 3 delays model.
A lot of delays occur within the household about when to go for services and at what cost. Of course, the terrain is bad, and there is in many villages in northern Nigeria where they do not see means of transport. And once you get there, will the service be available?
PRRINN-MNCH are working to address these problems in many ways, such as training and education.
If we didn't have the training or knowledge of how to confront our women on coming to hospital, how can this woman have her own child after 8 pregnancy with none alive, then achieving the 9th one alive, and she's okay?
By building on the social capital achieved through intensive stakeholder engagement, PRRINN-MNCH is addressing 3 delays concerns with a dynamic strategy. The cluster care approach strengthens services and systems in a manageable yet meaningful way. It improves maternal, newborn and child health.
The cluster approach is trying to ensure that resources are appropriately targeted so that access and utilization of services is improved. In a population of 500,000 people, as a minimum, you should have a facility that is providing a comprehensive emergency obstetric care.
Cluster care is gaining the approval of local doctors, midwives and community leaders who have experienced its results firsthand.
Our ANC there is 1 room. He decided to extend it to 2 rooms and also free drugs to eat and pay every pregnant woman.
Early results say it loud and clear. The stakeholder-owned cluster care approach is protecting families and creating sustainable community change for good. Despite these positive results, there is much work still to be done. Many lives continue to be lost through a lack of quality obstetric care and coverage.
If we really want to reduce maternal and child death in the north, we have to link up with those who bear the burden of the death.
Key partners are now embracing a strategy of primary health care under one roof, taking cluster care to the next level. And with political will, many problems can be overcome, but challenges remain. Now northern Nigeria aspires to securing universal health coverage by 2015, helping achieve its Millennium Development Goal. The evidence is clear. With PRRINN-MNCH intervention, more lives are being saved.
The communities were so happy that they organized a celebration that for 2 years, they have not seen a case of a woman dying from childbirth.
More lives can be saved.
Pregnancy and childbirth should be a matter of joy. It shouldn't be a matter of death.
And with continued investment, more lives will be saved.
Tuzuru mai shekara 30 har zuwa 40 har ƙasan 30 ban so muke a kausai. Kullum yana a zaure matan ƙannansa sun kaci sai duk wanda ta yi kwaɗon zonga.